Since you can see it already, what is this organ first? We see tubules at the periphery of the slide. We see lots of glomeruli. Some of these with hyalinization. Kidney, yes, thank you. And we should describe the changes side by side and step by step depending on the idea where we start and what we see. So a glomerulus with hyalinization, other glomeruli which are completely healthy here, others which are with changes perhaps in the proximal tubules due to postmortal lysis of the tubules. This is not kidney failure due to ischemia. And later, what we observe further on the slide, that would be interstitial diffuse inflammatory infiltrate, which starts near huge vessels, further goes through inflammatory area, which is interstitial here, and pretty much invading most of the slide on this side. So again, kidney glomeruli, what are these stuff here? That's something interesting that you should be able to recognize. These are nerves. We have some innervation here. So these are nerves. And here, what we should observe would be interesting as a smaller magnification. You may describe 3 specific fields, 1, 2, 3, and others surrounding them, which are filled with glomeruli, inflammatory infiltrate, but majorly these huge fields appear pretty much acellular, circumscribed by something like a pyogenic membrane, and the inflammatory infiltrate inside is merely made of lots of which type inflammatory cells? Leukocytes. So this is acute pyelonephritis. With what? Abscess formation. They are forming abscesses inside. Those are cavities which are filled with inflammatory cells, leukocytes, and they are having borders which are marked as pyogenic membranes. The pyogenic membrane must be having a couple of layers depending on how long the abscess cavity has been inside in the organ. And these layers are majorly marked by granulation tissue. But here we have it actually. We have small, newly formed vessels, eventually some fibrotic fibers here and there. Did it disappear? Yeah, sorry, I will share it again. No, it's disappeared for me also. I will share it again. You know this happens sometimes. Yeah. I think you see it now well. So again, granulation tissue at the pyogenic membrane, an abscess cavity which is filled with neutrophilic leukocytes. This is what we should observe at this type of slide. So if you increase a little bit more this field, you will pay attention on the idea that one more abscess cavity is trying to form here. Again, an abscess. So the larger you make the slide, the more evident changes are, again, huge formation of abscess cavity, which is filled with neutrophilic leukocytes, and in the border of which very often there is formation of pyogenic membrane, which is majorly marked by granulation. And couple of fibrous tissue strands remarked, also some newly formed vessels again, and it's not an exclusion, and you should expect it in granulation tissue, to have lots of lymphocytes, which are the roundish inflammatory cells, small dots, right? The others, which are with cemented nuclei, those are the leukocytes, but that's completely clear for you. You're already a fourth year student, so you should be aware of this fact, and you are. So your and my diagnosis here would be acute pyelonephritis. Now the professor here might ask you how exactly these changes developed in the kidneys. What is the way for pyelonephritis to start? Ascending and descending. How many types? Eventually by hematogenously spread infection, also the kidneys might be affected, or through the urinary pathways. And what is the inflammatory infiltrate? Which kidney is affected? Either one or both of these most of the times. You should mention that this process is asymmetric. Usually only one of the kidneys are affected. And pretty much that is all about this type. And most often causes for pyelonephritis in humans, which would be either blood spread infections as streptococcal and staphylococcal infections, or urinary infections such as usual infectant, which should be at the gastrointestinal tract, which are Escherichia coli, Proteus, Campylobacter. All of these are usually found there, but when they happen to be in the urinary tract, they might cause cystitis and pyelonephritis. So pretty much that's it about this slide. Now let's share the next one. Do you hear